One of the biggest problems with the insurance industry, in my opinion, is the use of complicated words or jargon, as you may like to term it. So one of the objectives of this YouTube channel is to go through a lot of these words and to explain them in very simple terms so that people can understand what it is that these terms mean. Okay, so the first couple of words that I want to talk about, which is used pretty much in every single health insurance policy, is inpatient and outpatient care. So first of all, inpatient. So inpatient cover will cover you for medical expenses which are incurred once you've been admitted into the hospital. So an admission into the hospital is when you go see a doctor and they say you need a bed, we're going to admit you into the hospital. It's actually a process of a doctor going through an admission process where you are basically sent into a hospital bedroom for typically more than one night. And that compares to outpatient. Now, outpatient is basically any expenses incurred when you don't need to be admitted into the hospital. So normally we'll be talking about general doctor's visits, medicines, maybe some tests or x-rays, MRIs will be covered under outpatient coverage. Okay, now there's also something to confuse things sometimes is what we call daycare. So daycare is when you require a surgery or a procedure which doesn't require you basically spending a night in hospital. So what hospitals will often do is they will call it daycare, so you're going for several hours, have the procedure and then go home. So with a lot of insurance companies, daycare procedures will fall under inpatient benefits.